What was the change management strategy and how was it implemented? Meaning, how do you manage the changes as these, new systems are implemented and processed?
So for us, this was a complete organizational change. We started our journey with the initial workforce analysis, right? So we had, we supplied data, we worked together to try and figure out where we were and where we wanted to be. After the analysis was done, we looked at the data. We had a lot to change, right? So we started small in the beginning, but all of these things, and like you said, we've been in partnership, or we've been in, working together since 2021. So it hasn't been a huge amount of time, but in that time, we've changed a lot. Our first order of business was to create a resource management center, the RMC, and provide staffing resources in that location so that they were able to manage the systems and deploy staff as needed. That was a huge change. So we had to get everybody on board with trusting what was going to happen. And, for some healthcare leaders, they're they like to manage their own areas their own way and keep their hands on it so that they know that they're doing what needs to be done for the unit. We were actually turning over control into the Smart Square system and into the RMC, and that was a huge change. I think what helped us is seeing the results and constant communication about where we were and what was happening. Having a lot of interactions with the team from AMN as well as internally helped us keep that transparency going so that we were able to adjust and pivot if needed. It was a complete overhaul of how we do things. And here we are 2.5 years later, and there's very little concerns with what we've done. And we're, actually we have shown, and I mean, all the data supports it, is that our fill rates and our staffing, we're staffed appropriately. That was the biggest challenge. That how is this system going to predict what we need? I know I need X number of nurses for Saturday night. And that just leaning in and trusting the system was very difficult, but we kept doing it. And from there, there is never concern anymore, truthfully.
Thank you for joining us today on Elevate Care. If you found this episode valuable, please consider sharing it with a colleague and subscribing to our show on your favorite podcast platform. You can learn more about this episode and our show on our website at amnhealthcare.com and follow us on social media to stay updated on new episodes and the ever-changing world of healthcare.